Hey, good afternoon, everybody. Grab a seat if you find one, and got a full house today. This is great. Well, welcome to our weekly press briefing. We've got several items on the agenda today that we wanted to inform the public about happenings both in the community and in South Central in general. First, we want to talk about upcoming event, the prescription drug disposal event, and I wanted to welcome Mary Sullivan to the podium, if Mary could come up. Mary's the program, no relation, I don't think. Long lost cousin, county court in the 1800s. Okay. Mary's the program manager for the Senior Behavioral Health Coalition at Aquila Incorporated, a member of the Muni Senior Citizen Advisory Commission, and a founding member of the Alaska Safe Medicine Alliance. And she's going to give us an update on the prescription drug disposal event coming up this Saturday. Mary?
Thank you, Mayor Sullivan. Yes, as the mayor said, my name is Mary Sullivan. I'm one of the founding members of the Alaska Safe Medicine Alliance, and I have Ruth Carter from the USDEA, Drug Enforcement Agency, with us here today. You know, there's a national Take-Back Day happening on September 25th, and in Alaska there's some city, borough, state, business, nonprofit entities that have come together to host the first ever statewide prescription drug disposal event. Unused or expired prescription medications are a public safety issue, and they often lead to accidental poisoning, overdose, and abuse. So the idea of this disposal event is to reduce access in our homes to these excess medications and thereby make an impact on this public safety issue. Anchorage Water and Wastewater Utility is also one of our partners, and they encourage people to use the safe disposal event to help keep our environment healthy and clean. So we hope everyone can make it in Anchorage. It'll be at the Fred Meyer parking lots on Muldoon, Northern Lights, and Abbott, as well as at the Alaska Native Medical Center parking lot. And people can go to www.dea.gov and click on the Got Drugs logo to find a location near them statewide. There's also flyers here in the back for people here who want to come and get some. So thank you for the podium. Is there anything you want to share, Ruth?
No, I just want, the one thing I would like to say is we would like to thank the state of Alaska for their participation. This is our DEA's first national Take-Back Day, and we've had a lot of cooperation from the Alaska State Troopers, the Anchorage Police Department, as well as Mary's organization, the coalition that Alaska has formed, and we want to thank you all for the participation.
Thank you.
We'll take any questions if there are any at this time.
I have a question. Is this event something that you've done in other communities throughout the U.S. and now adapting to Anchorage?
Well, we've done there have been some jurisdictions across the United States, like New Jersey did a take-back last year. The entire state did a take-back. And North Carolina has done a take-back. But this is a national take-back. Every single state in the United States is participating. It's going to be on September 25th between 10 and 2. It's the first national one we've conducted.
And actually, if I could speak to that, in Alaska, we piloted some events back in the spring. There was an event in Juneau recently, in Ketchikan, Matsu. So there have been some smaller events here in Alaska, but this is the first coordinated statewide event that we're partnering with the DEA on.
I came in a little late today. I missed it, but why can't you just throw away your prescription drugs?
That's a great question. One of the things that, like I mentioned, the Anchorage Water and Wastewater Utility suggests is using a safe disposal like this so that it prevents those personal care products from getting into the environment and potentially harming the environment. So they encourage people to use safe disposal events that these drugs will be taken by the law enforcement agencies to an EPA-approved closed incinerator and destroyed there. So that's why we're encouraging people not to flush them down the drain. Do you have other things to say?
Well, when you throw unused drugs in the trash, especially if you throw them in their original containers, a lot of times those can be stolen, and they have been stolen, and then they're basically either abused or sold on the streets.
Are there any statistics following the harm, either statewide or within the municipality, concerning drugs that weren't disposed of properly?
Well, in Alaska, prescription drug abuse has increased sevenfold since 2005. So we do know that. We don't necessarily have data about the improper disposal, but we do know that according to the National Partnership for a Drug-Free America, about 1 in 7 teens today in America admits to abusing prescription drugs, and about 55% of them get them from our homes. So the Alaska Safe Medicine Alliance is concerned that people secure their medications in their home, monitor their medications, and then use safe disposal events so that you can reduce those stockpiles. The other issue is the senior population. About the average senior citizen takes about 4 medications, and in Alaska that's probably higher because we have a lack of access to primary care currently for Medicare beneficiaries. So they go to multiple specialists, get prescribed multiple drugs, and then don't have someone overseeing that. And if the dosage changes, then you have multiple sets of those multiple medications. In fact, one member of our coalition is on 17 medications every day. So this is a lot of medications to have in our home, and we want to make sure that people have a safe way to dispose of those. The DEA governs how controlled substances are handled, and so if you are not the end user, if those controlled substances are not prescribed to you, it's illegal to be in possession of them once they leave the pharmacy. And so you can't just bring them back to your doctor, you can't bring them back to the pharmacy. If you flush them down the drain, you could be harming the environment. If you throw them in the trash, it could be another public safety issue. So what do you do with them? And that's sort of why we formed and why we hope that people will use this event. And that we hope this event will turn into something we can do in the future in our communities as well, to provide this as an ongoing service rather than just an event-based service. So
since this is an event to dispose prescription, is there any type of permanent place in Alaska or in Anchorage for this?
There's not a current place in Anchorage right now to dispose of medications. Some police departments, like in Ketchikan, are collecting medications whenever people want to bring them in. But I'll let the DEA talk to that because they have to give approval for those. So.
Yes, basically, right now the federal law does not allow end users to return controlled substances to pharmacies or hospitals. But what DEA can do right now is give a waiver to police departments or any law enforcement entity to collect the drugs. And so there are several that are doing that already in Alaska, but as Mary said, none in Anchorage at this time. But I have been told that we should expect the Anchorage Police Department and possibly the Alaska State Troopers to ask for a waiver so that this will be available to the public.
What about Wasilla or Palmer?
In Wasilla, they're hosting an event at the Fred Meyers parking lot in Wasilla, and they're also hosting an event in Talkeetna, and you can go to that www.dea.gov website and enter your zip code, and you'll find the locations that are registered near you. So I don't have the name of the one in Talkeetna, but you can go to that website. There isn't a permanent place for you to dispose of meds there, but they are. They did participate in the pilot project, and they're also participating in this National Day and are members of the Safe Medicine Alliance. So I anticipate that they will be looking for a permanent solution as well. And we hope to, we've been working with the Amada and Abada Board and the Alaska Mental Health Trust, and we're hoping to secure funding that would allow us to look for a more permanent solution as well.
Very good. Thank you.
Thank you for the time.
Yeah, my pleasure. And I know we'll have a very successful event this weekend. Thank you for all your hard work.
Thank you.
I want to also recognize Chris Kaczynski from AWWU. Chris, are you here? Oh, hey, there you are in the back. Chris has been working on this project as well from the utility standpoint. Appreciate all your hard efforts, Chris. You bet. Well, the next announcement we have to make is really very exciting. As you may know, the focus in this administration when it comes to community grants and other discretionary spending, where we have to make decisions about where we fund things, our focus has been on youth. We want to make sure that the youth in this community get a hand up wherever possible. And so I'm pleased to announce that Anchorage was just selected as one of the 100 best communities for young people in America. And when you consider the tens of thousands of communities in this country, to be one of the top 100 is really something special. This is the 4th time we've won, and we're enormously proud of the designation. And we just received the special seal, which citizens will soon see posted at several locations around town, kind of the entrance areas to town where we have our Welcome to Anchorage signs. And this is the seal, and this will be going up again in prominent locations. Now, the 100 Best Communities for Young People recognizes extraordinary community-wide efforts to improve the well-being of youth and end the nation's dropout crisis. More than 350 communities entered this year's competition, representing large cities, suburbs, counties, rural towns in all 50 states. Our application was a collaborative effort led by Anchorage's Promise for the Mayor's Office, involving more than 20 agencies, organizations, and individuals who responded to questions within topics like youth involvement and access to health care. Today it's my privilege to introduce to you a few local young people who wrote testimony for our application.